The Stanford Health Policy faculty are involved in teaching in many different ways. We teach undergraduates, we teach graduate students. We have, of course, our own degree programs, a master's degree program, a PhD program, and we have postdoctoral fellowships where we train people who've already gotten a PhD or an MD to do health services and health policy research.
Working on education is one of the most important things that we can do. We need to see a generation of leaders coming up, and we need to continually refresh the leadership that we have in health policy in the country. And I really see that as something where we can make an enormous contribution.
Spending a lot of time working with students, both in classes and on research projects, is part of the DNA of the department. And for me personally, this is one of the ways that I can help contribute to having that next generation of leaders in health policy, and also contributing to make sure that it's full of diverse perspectives and people from a variety of backgrounds, because we need to have all of those unique perspectives in order to have better solutions than we've had before.
It's really difficult to think of something that's more inspiring as a faculty member, to see both the enthusiasm and the impact of work that a young person can do.
One of the things that has just been incredibly inspiring has been to see the extent to which our students and trainees really, without even hesitating, put aside a lot of the work that had been their major focus to really spring into action to lend a hand to the COVID response.
I really wanted to have a bigger impact on healthcare beyond just clinical skills or just beyond the clinical space. When I also worked as a physician during my internship, COVID happened, and that really made that conviction stronger for me, right? Beyond just clinical, how can I have this broader impact on healthcare?
You really are put in a great intellectual environment here at Stanford. And we have great people, but the idea is not that you just come and sit at the feet of one professor and learn from that one professor how to do exactly what the professor does. You also network and learn from other people on the faculty, and you develop your own path. You learn how to work across disciplines, and that is a very, very important skill nowadays, and especially important for team science, but also for policy work. If you want to get something done in the real world, you need to work with people with all different backgrounds.
What we're looking for are people who are passionate, who have some technical aptitude and have a lot of grit and perseverance and creativity and independence. Our students have those things. That's what makes them so highly successful and such a pleasure to work with.
So this summer I worked as a Stanford Health Policy Fellow in an undergraduate program with Dr. Elise Adams. And we were doing a project relating to financial toxicity in cancer.
So we have a 7-year-old male with a history of elevated blood pressures.
This is a federal qualified health center, so it has a lot of services provided in addition to primary care. It's very purposeful that we send our pediatric residents and medical students here. It's part of the mission for Stanford to serve the community.
It's really important to our health policy faculty to serve as mentors to our trainees, as well as students from the university at large. And we do this in ways both big and small. The smaller way is just helping our trainees understand how to apply the knowledge that they've learned while they're students here. The bigger way is helping them chart a path where they can make a contribution to a cause that they feel deeply about.
I feel like Stanford has really opened this wide range of opportunities for me, and I'm really looking forward to the future.